Well, welcome back. We are now at the very last of the morning sessions for the seminar, and this is a Q&A time. So this is the time where everybody has opportunities of asking questions. There is no limit on the questions except for time, so you can ask questions about anything and everything, and if it's really off the wall, I'm going to field it to somebody else and let them answer. And if it's something really simple, then I'll take it and answer. And if you don't have questions, then I have questions for our panel as well. So you can distribute microphones so that individuals can answer, and we'll just make sure that that those are on. I want to go ahead and just do some mic tests and make sure that we're...
Hi.
Hi.
All right, let's make sure is it turned on? Just want to make sure that we're on. All right, well, we'll figure out electronics in just a minute. And make sure that we have things together. All right, and before we begin, let's go ahead and begin with a word of prayer and ask for the Lord's presence to be with us. Dear Heavenly Father, we thank you for your abundant mercies and your goodness to us as we have the opportunity of being together now and having a question and answer time. We ask for your blessing to be with us and for you to work out your perfect will and way, we pray. In Jesus' name, amen. All right, another test. All right, well, we do have two microphones that we can pass around. Andre will work on that one, and then we'll work on pulling that together. All right, just as a reminder, we had myself with natural treatments for common diseases. I'm Mark Sandoval, and Ashwin Sukumaran, there we go. He was doing COVID-19. We had Why We Sleep by Adan Sanchez, and then we had Stress and the Mind-Body Connection with Marvin Randall, and then we had God's Intelligence in Essential Oils, Nature versus Antibiotics by Mirna Vergara.
She's invisible.
Yes, she has her invisibility cloak on right now. Then we had type 3 diabetes with Oyinka Adiogun. And then we had wet sheet packs with Eric Kelly. We had brain and gut pain with Julie Hayek. And we are looking at understanding lab values, and Don worked on that one as well. Now we have our Q&A panel, and we also have Shanice Saunders, who is part of our medical staff as well. So we're all here to look at answering questions that individuals may have. And the first question that we have was actually sent in online, and it has to do with how do we treat cataracts at Uchee Pines? How do we treat cataracts at Uchee Pines? So I'm going to throw that question over to Uchee Pines. And anybody that will take up a microphone and answer. And dun 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 dun.
Maybe I can get it started.
Okay.
Get it started, or we're gonna be here a while. And there's definitely research that shows that a higher intake of fruits and vegetables actually will decrease can potentially decrease the risk of developing cataracts. So that's one thing that some of the studies are showing. Anyone else have anything else?
Well, taking into consideration what you were saying, one of the things in order to prevent this oxidation, right, and this damage, one of them could be antioxidants, but also sometimes, I like to use for any kind of problems related with our eyes, apply aloe vera. Aloe vera it can have a good anti-inflammatory, antioxidant properties as well. Not, of course, not inside your eyes, but like a poultice over your eyes, it can help as well. Aloe vera poultice over. You can close your eyes and you can put it over.
Over the eyelid. For those that might be wondering, cataracts, basically what cataracts are, it's oxidative damage or oxygen damage to the lens of the eye. And that oxidative damage causes the lens to turn from its usual clear appearance to then become a bit more kind of yellowed and obscure, and so it becomes more and more opaque, so it's more and more difficult for the light to go through it. I'm trying to think. I don't know if you've been to a house that had old windows, old windows that were made before the common era of windows, and you know that over time they kind of get a kind of a yellowish appearance, maybe a little bit wavy, and you don't get as much light that's going through it. Same type of thing is happening with the lens, and so it changes one's perception of color. And it changes how the brightness of light that comes through, and so things begin to dim, and it becomes more difficult to see. You typically first begin to see problems associated with it at night, and then with driving and with cataracts, then you start getting this glare that happens. It becomes more difficult to handle oncoming lights. With vehicles driving at you, and then being able to adjust to the dark, that becomes more and more of a problem with cataracts. And then color perception, although people usually don't understand or don't recognize that they have a problem with color perception until they have cataract surgery and they have the implants put in, and all of a sudden, oh wow, look how blue everything is. I didn't realize I was missing out on blue because there was so much yellow that was there. Somebody else, you want to talk about the usual treatment for cataracts, like conventional wise? The microphones.
Yeah, well, a lot of times the conventional treatment is a surgery, just removing the film there, and it can have decent results.
Yeah, and surgery is pretty quick. And there are some that I know somebody that does cataract surgeries in India, and he has specialized a technique, and he can do cataract surgeries
2 minutes.
In about 2 minutes.
Yeah.
He can do, so it takes him 2 minutes to cut open, get the old lens out, the new lens in, and can do hundreds of replacements in a day.
Yeah. He showed us his technique once. That was really cool. Just seeing him do that.
Yeah. So the typical treatment is surgery and replacement of the lens. We have not had, as far as I know of, the experience of somebody treating an existing cataract and having it go away from a natural standpoint. That's why everybody was kind of sitting around waiting who's going to say that, well, we haven't actually seen that turn around. I have heard 2 reports of individuals that have used lemon juice, so drops of lemon juice in their eyes, so a drop or a couple of drops in each eye, once a day or a couple times a day, and reported that, and these are reports that I had firsthand where I talked to the individual, and they were the ones that were doing it, and they had problems with cataracts, and they said that the problems that they had with the cataracts went away, and that was with lemon juice. So juicing the lemon and then using that juice and putting a drop or 2 in the eyes. They said at the beginning, it's really annoying because it burns, right? But after a while of doing that, you get used to it, and it's actually not so problematic.
Yeah.
So what I'm going to do is run around also as we have hands up so that we can catch some of these questions.
It's not a question really, but a friend of mine, we grew up together in church, and I went to visit her. She moved to Belize, and I went there to visit her. And it struck me that she was driving in the night without her glasses. I said, "What happened to your glasses?" She said, "Girl, I haven't worn that thing for 7 years." I said, "What did you do?" She said she put lemon juice in the mornings and honey in the evening. Well, I decided to try it. I almost jumped out the window. But anyhow, every time I get that cloudiness over my eye, I would do it for a couple of days. And when my eyes clear up nice and bright, but they would come back. I know I should continue in order to get it, but it's not easy to drop. If somebody was there to open and drop for you, but when you have to do it yourself, you
squirm and try to get away from yourself.
Yeah, and I guess some of the things that we can also focus on when it comes to cataracts is prevention. Taking in, like I said, a higher amount of fruits and vegetables, but also doing away with certain things that have that are known risk factors, like alcohol, for example. Dairy products are risk factors. Type 2 diabetes, people who have type 2 diabetes are at higher risk. Obesity, higher risk. So there are other lifestyle factors that play into whether someone develops cataracts or not as well. And from a lifestyle standpoint, I would say that's what really needs to be emphasized. And then, and I'm glad to hear that works. That's amazing. I mean, I'm just adding it to the collection. You're not the only one I've heard that same kind of experience from. So maybe we should do a trial someday.
Yeah, placebo-controlled trial.
Yes.
Yeah, I wonder what the placebo could be for lemon in your eyes.
Salt water.
Yeah. One drop, not a couple of drops. You could reduce it to half a drop by putting a tiny, tiny dropper and one water. You mix it, it doesn't burn as much.
Yeah, okay, so the advice for those of you that are online is one drop, not a couple of drops, and you might be able to reduce that a little bit by diluting it slightly with water so that it doesn't burn necessarily quite as much. All right. Another question?
My question revolves around B12 supplementation. So if the ideal diet is to be on a plant-based diet, why is it that we, run the risk of being deficient in this vitamin, and should we then consume animal products?
Okay. All right.
I guess I can start with it. Part of the reason is that we likely got a lot of B12 from the soil. It's generated from bacteria, and as soil has been depleted and vegetation has been depleted over time, it could lead to having inadequacies from that. That's one possible cause.
Mayenka?
You also have your normal gut bacteria, and you have bacteria that actually produces B12, which is where the animals that people are eating get their own B12 from. And somehow with the gut bacteria over time, a lot of people have lost the actual bacteria that produces the B12. And so, yes, we do need that supplementation. Now, does it mean that if you eat animal products or animals that you'll actually get the B12? Not all the time. You can actually lack B12 if you were eating animal products. So it's not just a vegetarian or vegan problem or issue. So you still need some sort of way to replenish it. Now, I know there are people out there that are actually trying to see if they can isolate out the bacteria that actually produces the B12 and have it grow in certain ways, but it's still in the research phase. In the meantime, supplement.
Well, a higher fiber content, like what Dr. Yanko was sharing, can also help with that, with the gut flora, and in encouraging those bacteria that need to be there. As well as there are some other foods that we can take in our diet, like purple laver is one, and mushrooms, and of course there's some of those fermented foods like tempeh and kimchi. Those kind of things tend to have more B12, but we don't usually encourage people to eat fermented foods. But basically, taking, like I said, purple laver is a good source. Getting some mushrooms in your diet might be a good thing as well. But it's a very small amount. The other thing is also we lose some of the B12, like what Eric was saying, because a lot of it's soil bacteria, and we spend a lot of time washing our vegetables too. And so sometimes what would be nice is just to have your own garden where you can get the produce more directly with less washing in the middle, and God made dirt, dirt don't hurt.
Also,
You don't want the mic?
I just want to say something. Isn't the bacteria also in the mouth, like during the night when you sleep? So you don't have to really get from the outside. That's why they recommend that you don't brush your teeth first thing in the morning, that you have your breakfast or whatever. But for years I've been brushing my teeth until I found that out, because I says I don't want to swallow that yucking from the night, But when I understand that the good bacteria is in there, then I try to eat first and then brush. That's just...
Yeah, how much of it is in the mouth, I'm not exactly sure. Shannon's got one back there when you get a chance. But most of the vitamin B12 producing bacteria end up being then in the colon and the lower gut. And that's where most of your absorption of B12 is going to happen as well. And yes, I think a major part of the problem is that we're more separated from the garden. Most of the population until the last 100, 150 years has pretty much lived close to the soil. And I don't think a B12 deficiency has been a major issue until really the Industrial Revolution. And although I don't have a way of confirming that, but I know that we haven't, what should I say? Yeah, I don't have a way of confirming that because it's not like we had LabCorp back in, 150, 200 years ago to do blood samples to check for vitamin B12 deficiency. But individuals have done fairly well from that standpoint, especially when lives and lifestyles have been close to the ground. I think, I personally believe that God did create bacteria, and there are plenty of good bacteria that He created, and God placed man in a garden to live in that environment, and in that environment it provides the things that you need. But when we come and we are removed from that environment significantly, so yes, you have a farm that's producing it over here, but then you've got a wash station that it goes through, and then you've got the grocery store and refrigeration, and then you bring it home and you dunk it through your own washing or your vinegar or your whatever that you do with it, and so on. Then whatever bacteria, good soil bacteria you would have had, then well, bye-bye. It's been washed off and and removed along the way, and so you don't have access to that. Another quotes vegan source. It's not actually natural. It's produced, but that's nutritional yeast. So nutritional yeast is also a fairly good source of B12 as well.
I guess also in regards to diet, a lot of sugar in your diet decreases the amount of B12 you have. So, yeah,
Yeah, limiting sugar intake.
eliminate sugar or just moderate it.
All right, we have another question from online.
Yes. So real quick, the person who asked the cataract question, they said, thanks, God bless you. And there's a question here from the live stream. It says, good morning, doctors. I urinate frequently at night and it's dark foaming color. What could be the problem?
Okay, so urinating frequently at night with dark foamy color. Dark foamy. All right, somebody want to jump on that one?
Well, first you want to find out how many times you actually urinate during the day and how many times it's occurring at night. And then you want to get an analysis of the urine to actually see what's going on, what could be contained in the urine that can clue you into what's going on. If it's dark, the next question is, are you hydrating well during the day? And if you're drinking most of your water at night or evening, yes, you will be going to the bathroom a lot during the night, because the body will still try to get rid of the waste that it needs to get rid of. And if it's getting the volume towards the end of the day, then that's when it starts to actually work. So a few questions that you can answer and try to tweak to find out what's going on. With the foam, some people will say it's protein, but not all the time, hence the analysis of the urine. You want to find out what's actually in the urine.
Yeah, and as far as color is concerned, in dark color, the question is what variety of dark? If you're looking at a dark yellow color, that's different than a Coca-Cola colored dark. If you're talking about a Coca-Cola colored dark, so kind of a brown dark coloration, that's a warning sign for rhabdomyolysis, which means that the muscle cells are breaking down, and quite a few of them in a fairly rapid period of time, and so you have a really large protein load on the kidneys, and it can turn the urine kind of a Coke colored. And that's dangerous. So that usually doesn't happen for a long time without you having problems, real significant problems. If that's the case, usually somebody has, you have like an elderly individual that falls on the floor and then can't get up and struggles for a number of hours to get up off the floor. And then eventually is found by a family member and then is assisted up. But during that process, you have a lot of muscle breakdown that happens. That's one of the scenarios. Another scenario is if you're on cholesterol-reducing medication, statins. So the statins can cause rhabdomyolysis as well, and that muscle breakdown, and then the dark-colored urine as well. And then yes, as Dr. Oyenka pointed out, then if you have foamy or frothy urine, one of the things that's pointed out is protein, and having high protein content in the urine. There's the question, if that's the case, then there's a question of kidney failure. There's a certain type of kidney failure that includes high proteins in the urine, but also if you have high proteins in the urine as well, then that can be involved with overproduction of antibodies and a high antibody content being dumped into, or pieces of the antibodies being dumped into the urine, and creating a situation like that. So it's difficult to say just with that description. What we would recommend is going somewhere where you can get a urine study being done, a urinalysis. And so check the urine, but also there's some blood studies that you would want to check with that as well. One of those would be your comprehensive metabolic profile, which gives you kidney function, but it also gives you liver function and electrolytes, and also looking up a CBC, or a complete blood count. That would be something that would be recommended with that as well. And then if you're urinating frequently, sometimes that can be because of increased sugars. If that's the case, then the comprehensive metabolic profile includes a glucose in there, so that should give a clue if that might be the case also. And then another cause for frequent urination at night is prostate. That's right. So prostate enlargement. So if that question came from a female, that's not going to be a problem, we hope. And if it came from a male, then that could be a problem. So if we had prostate issues, what would you do for that?
Okay. Well, I think that could be one of the first questions, if it was a male or female, right? For prostate issues, well, enlargement of the prostate, it's going to promote these kind of symptoms. Probably not the dark color. However, there is a complication already that it could be, but more than dark, it could be related with with blood. One of the things that we recommend here at the Lifestyle Center, it's in order to decrease the inflammation of the prostate or the enlargement of the prostate, is the treatment is called the hot sitz bath. You are going to have 2 containers, right, with one of them with hot water to tolerate and the other one with cold water with ice. And you are going to immerse the pelvic area of your body in the container with hot water for 3 minutes. Then you are going to continue with 30 seconds with cold ice water. And you are going to do this exchange at least 7 times, at least 3 times a week or 4 times a week. If you can do it every day, it will be good. Another recommendation, it could be also having sitting on the heating pad every night or every day, right? The heat, it can promote also the decrease of the inflammation of that area. And sitting on the heating pad at least 1 hour every night, it can help also with treating this condition.
Certain herbs too, like saw palmetto, echinacea, golden seal. So you can pygeum. There's a lot of herbs you can use as well, besides the hydrotherapy and water treatments.
Another thing that's more anecdotal, not necessarily like there's a lot of studies out there, but something that I've also heard is that anxiety can also make urination at night worse. So if you have more peace, you're going to be more relaxed, you might not struggle with it as much. So that's something to address also.
Yeah, and some behavioral aspects, make sure that you don't drink a lot of fluids later in the day. So cut off your fluid intake around 5 or 6 p.m. That way you don't have as much fluids later, and so you don't have to wake up as much throughout the night. There's another thing called double voiding, and so that's where you urinate, and once you're done, you kind of relax for a few seconds, and then you try to empty the bladder again. What's happening, the pathophysiology that's happening here with the prostate is you have the bladder, and the bladder, of course, is like a balloon. And then down at the bottom of the balloon, the prostate is around the exit of the bladder. So you've got the bladder that gets fairly thin like a balloon, and then you have the prostate that sits around that. And then as the prostate enlarges, it not only gets larger outside, but it gets larger inside as well, so that the inside or the passageway gets narrower, more narrow. And you can imagine if you have a balloon and you fill up the balloon, the bigger it gets, the more pressure it has. And if you have no resistance or very little resistance to the flow coming out, then when you release whatever well, you have a urinary sphincter, so you have a ring of muscle that holds the bladder closed, and when that relaxes, if there's very little pressure, then the bladder is just going to empty. And it will empty, and it'll empty pretty much completely. Well, what happens is with the prostate, once it starts constricting on that neck of the bladder more and more, then there's more and more pressure there. And so the bladder, it's going to empty until it gets to the point where it meets the same pressure that's in the prostate, or that the prostate is pushing on the bladder neck. And so as that pressure increases, the bladder is going to be more and more full when you're done urinating, right? When you're done urinating, because now the pressure in the bladder has gotten to the same pressure as the pressure that's being exerted by the prostate, and now it equalizes. Now there's no more pressure to push the urine out, and so the bladder becomes, it's more and more, it doesn't empty as efficiently. There's more and more urine that's left in the bladder when you're done urinating, and then it's quicker for it to fill back up till you get to the point where you feel like you got to go again. That's why the frequency comes, the urinary frequency comes. And so anything that you can do to relieve that pressure from the prostate will allow the bladder to empty more completely. The double voiding is just another way of, all right, you empty everything, you give it a little break of a few seconds, and then you bear down and you try to push again, and that bearing down increases abdominal pressure, and that puts pressure on the bladder from the outside and gives it a little bit more incentive to, a little more pressure to get the extra urine out, so that it takes longer for it to fill back up, and you can go longer without having to urinate. All right, we've got some other questions out here, so I'm going to run back to you, and we'll get your question.
Thank you. During the presentations, I heard a lot about cortisol, and it just seems like it's something that, it's a lack of it or whatever it is causes a lot of disease processes if it's out of whack. Can you explain a little bit more about cortisol?
Excellent.
So it's too much cortisol. So when you're stressed, your body releases these hormones. Cortisol is one of them. And you need cortisol basically to maintain your blood pressure, maintain your blood sugar, so forth and so on. It does a lot of other things. It potentiates a lot of other hormones, like for instance, epinephrine. It allows your heart to beat faster, but when you have cortisol and epinephrine together, it makes your heart beat even more faster. So like I said in my presentation, during the flight or fight response, you have an increase in the cortisol and an increase in other hormones, and cortisol helps you to fight or flight. And every day you have stressors, so you have to, every second of the day you're fighting or flighting, so you need this cortisol response. But if you have too much, then that can lead to disease, because you have an increased amount of sugar, you have an increased amount of fats, blood pressure, all these things, and that leads to high blood pressure, high blood sugar, high cholesterol, so forth and so on.
So am I to understand that stress increases cortisol levels?
Yeah, the question is, does stress increase cortisol levels? Yes. Stress increases cortisol levels. And like I said, your body has a homeostatic range for cortisol. And at night, it goes down. Right? So when you're sleeping, you don't need your blood pressure to be elevated. You don't need blood sugar to be elevated. So it goes down. And if you're still stressed at night, your cortisol is still elevated, and it's going to be elevated even to the morning time. So this stress increases your blood cortisol levels, and it then changes your body, and you're more prone to diseases.
So I have a follow-up question to that, because in the mornings, my blood pressure is high. So I am just like...
So for our online audience, just say that again.
So the follow-up question to that is, why then is my blood pressure so high when I get up in the mornings?
Well, it could be because of stress. It could be because of an elevated cortisol. Could have been what you're doing before the night previously. Could be a lot of things. Like I mentioned in my presentation, it's a lot of things that causes increased cortisol levels. One of them is not having trust in God. I've seen people with 3-4 different types of medications for blood pressure, and their blood pressure is still 180 over XYZ, you know? And the issue is what's going on internally. What are your internal stressors that you're not dealing with? And most of the times it's just trusting God and dealing with these issues.
One of the things I was going to say as well is like we can't just pinpoint it only to elevated cortisol levels. We have to ask ourselves what else is going on in my daily life. So yes, the stressors. What is my dietary intake like? Am I exercising? What are the different lifestyle factors that's going on? Are you taking your medications or herbs like you're supposed to? Are you sleeping well? So just different things like that. What comes to mind.
Yeah, and the sleeping well component of it is an important one. One of the things that is a contributor to elevated nighttime cortisol levels is sleep apnea. Mm-hmm. So if you have sleep apnea, and what sleep apnea is it's a condition where typically because of increased weight, that's the usual factor associated with it. There's two forms. You have a obstructive sleep apnea, which is the most common, then you have a neurological sleep apnea, or a central sleep apnea as they call it. And the obstructive sleep apnea, the one that's most common, is as the weight increases, then you have more fat tissue that's not just in the abdomen, but it's deposited everywhere, and it includes tissue that's around the neck and the throat and so on. And so during nighttime, with that increased weight, then you have the tongue that relaxes, you have the throat that relaxes and everything, and you have enough pressure that it starts blocking off the airway so that you have periods of time where you stop breathing. And officially, for sleep apnea to be diagnosed, then you have periods of at least 20 seconds of not breathing at a time. And usually, if you do sleep studies with somebody with sleep apnea, you'll notice that they have hundreds of episodes throughout the night time. And then those periods of apnea can last for a fairly long period of time. I have suspected sleep apnea with certain family members at certain times that snore very loud, and so snoring is one of the signs that you might have sleep apnea. So I went and like doctors do, we investigate. So I went and put a recording device with headphones, so because you can hear really well with that, and I just put it under the door while I heard periods of sleep. It's not like this is the greatest diagnostic tool, but anyways, just put it under the door jamb and listened while they were sleeping, and and then there's this kind of repetitive pattern that happens of snoring, and the snoring gets louder, and then it gets louder, and then all of a sudden it stops. And then you listen, and you listen, and you listen. It was 43 seconds before they breathed again. And then it goes around, and then the snoring starts again, and then it gets louder and it gets louder, and then you get to a period where they stop breathing. And again, 45 seconds or so of not breathing. And so you can imagine at nighttime, if you were stopping breathing like that, it's kind of like somebody choking you while you're asleep. And even though you're not consciously awake, you're sleeping, you still have a stress response associated with that, with the low oxygen levels and so on. It's like being strangled multiple times throughout the nighttime. And if that's the case, sleep apnea is definitely associated with elevated blood pressure. And one of the mechanisms through which it does that is your fight or flight response and your stress hormones, including cortisol and so on. And cortisol is associated with blood pressure and higher blood pressures, and so you can have higher blood pressures in the mornings with sleep apnea. And the fix for sleep apnea?
lose weight.
Weight loss, right? And it just depends on the individual as where that level is as far as the weight loss that's necessary in order to get to the point where, oh, you don't have it anymore. I've got another family member, and he's built quite a bit like me, but just had maybe an extra 10 pounds or so on the belly. And once his wife started cooking vegan, they were vegetarian, lacto-ovo vegetarian, but once they started cooking vegan, he lost about 5 pounds, maybe 10 pounds or so, and started losing it off the belly. Well, she noticed that he had sleep apnea, but once he lost that about 5 to 10 pounds, his sleep apnea stopped, and it went away. But it wasn't that he was, big overall, but some other individuals, they might have to lose 20, 30, 40 pounds, maybe even more, just depending on how big they are, till you get to that point where it's not exerting so much pressure on the airway, and you can breathe without those periods of stopping breathing at nighttime.
And it's not just fatty infiltration of the neck, but also fatty infiltration of the tongue. And when you're laying down, on your back, then that tongue kind of falls back and everything just closes things off. So if you're suspecting sleep apnea, you can lay on your side. There are also, this is something interesting I learned recently, is that there are actually exercises that you can do that decreases sleep apnea as well. You can actually, do neck exercises, and you can even do like certain stretches before bed and then laying on the side, and that seems to help quite a lot of people as well, as they're in the process of losing weight and stuff.
Mm-hmm. And then of course there's other things. There's dental implants that you can use that it's kind of like a bite block. Yeah. But then it has a hinge on it, and so you put it in, and then you kind of rotate it a bit, and it forces the lower jaw out. Mm-hmm. So that creates a little bit more space, so the tongue has farther to fall before it blocks the airway. And then, of course, the major usual treatment for sleep apnea is a CPAP machine. So you've got a machine that has, CPAP stands for continuous positive airway pressure. And so the machine just constantly pushes air pressure into you, typically through the nose. Sometimes it's a nose and mouth mask, and that way keeping the airway open so that you don't stop breathing at night. But some people don't like it because then you've got a device on your face, and you've got a machine that's roaring all night long, and so on. Probably the cheapest way of treating it is a tennis ball and a safety pin. So you get a relatively tight shirt and you wear it during nighttime. But before you put it on, you get a tennis ball and a safety pin, and you pin the tennis ball to the middle of the back of your shirt. So guess which way you don't lay down at night? On your back, right? And when you're sleeping and you turn over on your back, you got this big lump in your back, so it keeps you from laying on your back. So you lay on your side or other things like that, and then you don't have as much sleep apnea. So that's one way of treating it. All right, looks like we've got another online. Oh, well, hang on. You had your hand up first, and then we'll get to the online question.
This moved away from what I wanted to ask. I wanted to ask about, maybe I should call, I don't want to call it incontinence, but what else could I call it? Like if you get the urge to urinate and you don't, like when you're up, you're fine. You can get to the bathroom, no problem. But like in the night, when you wake up, by the time you put your foot out the bed and you get to the bathroom, like you have a little overflow. Mm-hmm. So that overflow would come out, but the rest you can handle. What could you do about that, not allowing that overflow to come out?
All right. Good.
That's one. Number two, the snoring. Some people can sit up and snore. You're not on your back, you're not laying down in any way, but you snore. And what is that all about? You know?
All right, I'll field both of those your way.
I can quickly comment on the number 2 question about the snoring. I mean, there could also be structural differences that people have that can cause that, as well as fatty infiltration, depending on, but that's all structural again. That's one thing.
Like maybe your adenoids.
Thyroid issues can cause enlargement of the tongue. But yeah, infection, all these things can cause snoring while you're sitting up. But in regards to the urination problem, Kegel exercises can help.
What kind of exercise?
Kegel
What is Kegel? Okay.
exercises, just being consistent with them and to strengthen your pelvic floor muscles, that can help to hold your urination or urine.
K-E-G-E-L, right?
Yes. Kegel, Kegel, Kegel. Yes.
Somebody want to describe Kegel exercises for maybe somebody that doesn't know what that is?
Who would like to describe it?
You can describe it. You can. I guess you could probably do it while you're sitting even in here, but it's probably better to do this while you're in the bathroom. But basically, you know that when you are urinating, you know how that feels. And then when you stop urinating, you know how that feels. So you're basically contracting those muscles, squeezing those muscles. And you do that, several times a day. And that can really strengthen it. Actually, pelvic floor muscle issues are not just with incontinence, but even some people have issues with constipation because of pelvic floor muscle issues. So it's a good thing to do. Yeah.
Just a better explanation for the Kegel. If you're actually urinating, that would be the best place to start. You hold the urine. So you start urinating, you hold the urine, you stop urinating. And that actually is your pelvic floor muscles that you're using to stop that urination. And then you start again. Go a little bit and then stop it. And you do this a few times, exercising while urinating. You get to the point where you know what it feels like to actually stop that urination, what it takes to contract those muscles. And then you can do it even while you're not urinating.
It's something that you can do. I could be sitting here and I could be doing it.
Yes.
Right.
Anyway, while you're
The
walking.
thing what I'm thinking about is like during the night, let's say I wake up and I think I want to go to the bathroom. By the time I get up to make a couple of steps, that first bit of, I call it the overflow, that overflow comes out. And then you can hold the rest and go for I don't know how long, but I wonder what causes that overflow? What causes you not to be able to hold everything? Like in the daytime, you can hold everything, right? But in the nighttime, I can't figure out what happens. So anyhow, don't worry about it.
Well, I was just going to say, it's still that pelvic muscle, yes, the strength, yeah.
Yeah, remember the bladder, again, when it gets more full, it has greater pressure. And if the pressure in the bladder gets greater than the pressure of what's holding the things in the bladder, then the urine's going to come out. So it's a sign of having those weak pelvic muscles, because once the bladder gets to a certain point, it'll allow the urine to come out. But once enough urine comes out that it equalizes the pressure of those muscles can exert, then it'll stop it and it'll keep the rest of the urine in the bladder. So as you strengthen those muscles, then it can handle a greater volume in the bladder without letting the urine out. So those Kegel exercises are important.
It's a lot of urine, just a little, a little bit. That could very well stay in, you know.
It's also when you relieve a little bit of pressure, it might be a little bit easier to hold it in as well.
And another thing to take into consideration, if you've had children, it will also affect the pelvic muscle.
And there also some individuals can develop incontinence related to food allergies as well. So sometimes that can be a manifestation of food allergies, is developing an incontinence like that. And so sometimes it's beneficial to do like a food journal and see if there are times when you eat certain types of foods and then have more problems with the incontinence like you have.
Like nutmeg.
Yeah, and Andre mentioned the development of abdominal gas in the bowel, and then that increasing the bowel pressure, and then potentially adding some pressure to the bladder as well. All right, we have a question from online.
Yes. First, the person who asked about the urinating at night, he says, thank you, panelists. One question is, what is the best supplement for B12?
No fighting.
Well, big complex, yeah. But B12 in the form of cyanocobalamin. There is another one that's it's a methylcobalamin. However, that's from animal source, I think. So you will have a better bioavailability from the cyanocobalamin than from the methylcobalamin. So cyanocobalamin, yeah, B12 cyanocobalamin.
All right, and the next one?
And the next one is, is there any natural treatment for adhesions after hysterectomy that causes pain? Yeah.
All right, adhesions.
Castor oil poultices might be able to help with that, and you have to be constant with it, and over a long period. So you're talking about months. This can actually help to prevent the adhesions from forming, or even dissolve the adhesions.
Fomentations would be helpful as well, hot and cold to the area for pain, depending on how recent the hysterectomy was, though.
Yeah, so for those of you that are wondering what adhesions are basically bands of connective tissue, fibrous tissue, that normally in the abdominal cavity, you've got, of course, the abdominal cavity, and then you've got the bowel that's inside, and the bowel is free to wiggle and squirm and do all sorts of somersaults and that kind of stuff, and it's nice and slippery and wet in there, and so things don't get stuck, and it can do all sorts of movements without getting twisted and tied up. But an adhesion is where under the situation of inflammation and the inflammatory response, you then start having the development of an adhesive tissue that adheres to the abdominal wall and on one end and adheres to the bowel on the other end. And so you can have the bowel or a part of the bowel that's stuck now to the abdominal wall. And that part of it is now stuck, but the rest of the bowel is mobile. So you can have the rest of the bowel moving around, and that part is stuck And so the bowel can then begin to twist on itself and then pinch off and create bowel obstructions. It typically is quite painful when the adhesions are doing that and you start developing bowel obstructions associated with it. So yes, as was mentioned, hot and cold applications to the abdomen, castor oil poultices can help with the inflammation and the pain associated with it, and sometimes prevent individuals from having to have surgery associated with it. But if somebody has adhesions and the bowel gets really twisted and there's a bowel obstruction and it's not being unobstructed, how do you know you have a bowel obstruction? Well, everything that goes down comes up because there's no way for it to go through. So you have lots of pain, you have vomiting. Depending on how high in the digestive tract the obstruction is, depends on what it's like when things come out. And so anyways, there's a lot of abdominal pain. You can't keep anything down. Everything comes back up and you get to the point where you're not passing any stool either because you got nothing that's going through. And then the abdominal pain just gets really, really unbearable. And if that's the case, that's a surgical emergency, and that would be a time to say, hey, into the ER. And ER, that's one of the times where they have to wake up the surgeon in the middle of the night and say, hey, you got to come take care of this now. Because if that bowel gets twisted, then it can cut off the blood supply to that section of the bowel, and you've got about 4 hours of time to intervene before that section of the bowel starts dying. And then if it dies, there's pressure that's in there, and then the pressure is going to allow it to break open, and then the stool and everything that you had on the inside now gets to the outside, and then you develop a peritonitis and an infection, and things can go downhill really fast at that point. On that happy note, we'll have another question.
Mine's a real quick, easy question. On the wet pack, do you need to monitor the person's temperature with a thermometer?
No, you don't really need. I mean, if you're trying to go for effect, like if you wanted to raise their temperature to beat a fever, then you could. But generally, it's more by time and the what you see it doing to the patient. So, for example, if you start seeing them go to sleep, remember we talked about that being at 30 minutes in. That's the neutral phase, and then they'll start warming up. And then they'll go into the heating phase, and then when you start seeing sweat on their brow, that means they're in the sweating stage, so it's more by what you observe. Yeah.
All right. Do we have any others right there? If we don't, then, somebody remind me, what's our cutoff time? What do I not want to go past?
12:45.
All right. So, all right, I'm just looking up here. You probably went over it, I'm sure you did. But Dr. Sanchez, I want to give us a summary of somebody that is having insomnia, and what would you recommend for them to do about it?
Okay, plenty of light during the day, exercise in the morning. Of course, having a morning routine is very important. Starting the day with doing, of course, devotions or exercise, or vice versa. Having a good breakfast, having a good lunch, regularity, rhythmicity is very important. Avoid suppers if you can avoid suppers, and if you should avoid suppers, well, it's better. Or even having your suppers like 4 hours before your bedtime. Having an evening routine, and when I mention an evening routine, well, no cell phones, no computers, having a brief walk during the sunset. That orange dim light, it can help to switch off your circadian rhythm and tell into your brain that it's nighttime. Not using this kind of bright light in the night. A blue light, remember that we mentioned about it. Also having a hot shower or a hot bathtub, it can help as well. You can use some supplements like a magnesium citrate if you want, but the idea is not to rely on supplements. The idea is that you are producing melatonin. You have those components in order to have a good night, right, of sleep. Don't make any call. You don't have to make any call. Don't make that call, stressful call, right? Get a book. Try to read something. The best one, Bible, of course. Read the Psalms. If you are not able to sleep, well, pray. Interceding prayers, right? Interceding prayers. Also, how can I say more about sleep? Try to minimize any activity that is going to activate your brain. Stress. We have been talking a lot about stress. And remember, stress is not what's happening around me, it's what's happening inside of me, and the response that I give into those circumstances of those events. Yeah.
All right. And Dr. O, you got somebody that's coming to you and they're starting to develop memory problems. You know, it's just not as sharp as it used to be, as it was, you know, before, and they're seeing they're slipping and harder to memorize things and forgetting things along the way. What are some brief, simple suggestions that you might have for them?
Okay. First of all, doing the assessment to see if this is something that's just passing, is whatever's contributing to it, a lot of stress, or is it really dementia? And once you've teased that out, a few tests that you can do with the doctor. Once you've teased it out and you think it's dementia, early onset dementia, then you start to go into the lifestyle. You want to start correcting whatever is contributing to the oxidative stress or inflammatory state of the body that's actually affecting the brain also, because what's going on in the body goes on in the brain, just different cells that are affected. And so one of the things you want to hone in on the nutrition. If they've been having your SAD diet, which is the standard American diet, which promotes inflammation, you want to start to correct that. Give them the diet that actually promotes anti-inflammation, which is your whole food, plant-based diet, and focusing more on your vegetables and fruits. And research shows, of course, that just taking a cup of blueberries daily over a long period of time, not just once in a while, taking it daily over a long period of time actually will help because of the antioxidant, anti-inflammatory properties that the blueberries have. Another good example, research also showed things that have lutein and zeaxanthin in it. These are your phytonutrients that you can find in just a cup of spinach daily or half a cup of kale. And taking that in daily will actually help to restore to actually fix the damage that has been done, the oxidative damage that has been done, and restore memory. Other things that you want to also focus on: exercising. And exercising, it doesn't have to be rigorous. You want to exercise at least 150 minutes in a week, and that breaks down to about 30 minutes a day. If you're one that is not used to exercising, just start with a walk. Going for a nice walk, you don't want to stroll. So if you can sing, carry a tune while you're walking, you're not walking fast enough. But if you're walking really, really fast and you cannot even talk and complete a sentence without stopping to catch your breath, then you're walking too fast. So find your nice balance and walk 30 minutes every day. If you can increase it, even better. But 30 minutes every day, 5 days a week, that will actually help. And of course, you're walking outside, preferably, because you'll get your fresh air and you'll also get your sunlight while you're walking. Of course, having your water intake, making sure you're getting the minimum water intake that you need. And this helps with getting rid of the toxins. Something else that you also want to make sure, your vitamin D level, you want to make sure that's optimal, not just within the reference range. You want it to be optimal, and optimal meaning if it's nanogram per deciliter, I believe the measurement is, it gives you a level of 30 to 100 for the normal reference interval. You want to make sure you're within 50 to 70. So supplementing, if you're not getting your daily sunbathing in, then you can supplement with vitamin D3 and make sure you're checking your vitamin D levels and you're not going above 70, but if you do, definitely not above 100, because your vitamin D is also fat-soluble vitamin, which means you can overdo it and start having side effects. Something else you also want to consider is rest. I had talked earlier in the week about getting your sleep in 2 hours before midnight is actually as important as, no, it's the other way around. 1 hour after midnight is actually as important as 2 hours before midnight, because one of the functions that actually happens before midnight, if you're sleeping, is your glymphatic system, which is like your lymphatic system in the body, but the glymphatic system is in the brain, actually gets its time to be able to clean out toxins from the brain. If you don't get those hours in, then the glymphatic system doesn't activate itself to be able to clear the toxins. And when this happens, you can imagine if you have garbage in the house and you're not taking it out and you keep accumulating the garbage, soon the whole place is stinking and you don't want to be in there. Same thing in your brain. You have the toxins pile up and they cause the oxidative stress and cause the actual proteins to function abnormally, and eventually your brain starts getting affected, which one of the symptoms would be the memory loss. You start to have issues with your memory. And of course, you cannot skip the most important aspect, which is trusting God.
Thank you. Got another question?
Yes. Here on the live stream, we have a question. What could cause swelling of face, legs, and arms? I am diabetic, running very high numbers. I learned that inflammation is the source of all diseases. What is likely to be the cause of the swelling?
All right, swelling of face, arms, and legs.
Yes.
Right, all extremities. But not the trunk?
That is not mentioned.
Yeah. All right, so we have a diabetic running high numbers and they're swelling. So what are we concerned about?
Heart failure. Heart failure could also be an issue with the liver as well. But basically, the swelling is due to the accumulation of water not being filtered in the right way. So it's being stored in your, instead of being in the vasculature, in your veins where it needs to be, it's in areas that it doesn't need to be. So it shows in your skin.
Yeah, so heart failure can be one of those. Of course, if the heart is not pumping very well, of course, you know, the cardiovascular system is set up, it's a hydraulic system, and of course the heart is the pump, and it's the thing that keeps things going forward. And you have, of course, the fluid or the blood that's going out from the heart. It goes through the arteries, and then the arteries get smaller, 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 smaller until you get to the capillaries, which are the smallest blood vessels, and that's where your oxygen exchange and nutrient exchange happens with the tissues, and then it goes into venules and then veins, and so they get bigger and bigger and bigger, and then go back to the heart. Well, if the heart isn't pumping well and you start developing heart failure, then it kind of builds up pressure behind the heart. So the blood that's coming from the veins back to the heart, that pressure kind of increases, so that it's more difficult for the blood to get back to the heart because the heart is not pumping very well. And as that pressure increases, it causes the fluid to then get pushed out of the blood vessels, the veins, and more so at the capillaries, and more of the fluid out, and it stays around the tissue instead of getting inside the blood vessels, and then that results in edema. The other major thing is kidney failure. And diabetes is the #1 cause for kidney failure. So that's definitely a concern. Cardiovascular disease, not necessarily heart failure, but cardiovascular disease is the #1 killer of diabetics. But diabetes is the #1 cause of kidney failure. You know, there would be a question of how much are you urinating versus how much are you drinking. Are you retaining more fluid than then you are urinating out, then that might indicate that there's kidney failure that's going on. That would definitely be of concern. Whatever it is that's going on, if your blood sugar numbers are high and you're swelling like that, I would say get in and see the doctor now. Don't wait around with that. Things can go downhill really fast, and you don't want that to happen. Now, in regards to the comment of all diseases begin with inflammation, it's almost true. Inflammation is an early part of the process of any disease process, but inflammation actually is a response. Inflammation is a response to tissue injury, tissue damage. So there's got to be something that's causing the tissue injury and the tissue damage that then leads to the inflammatory response. So inflammation itself is not the problem. Inflammation is an effect of the problem. The question is, what's the problem that's leading to the inflammation? Well, we're getting some pretty good wind right now. It's blowing, blowing, blowing. That's nice. And speaking of outdoors and nature and blowing wind and sunshine, and we have green that's starting to come in the trees out there. We've got blossoms. The azaleas are really starting to bloom. We're not in full bloom yet, but it's just beautiful. Eric, would you mind commenting in regards to health benefits associated with nature?
Sure, yeah. So there's actually a number of studies that are out there that looked at nature therapy. When you're outside, what effect does that have on the body? And there's a number of studies that suggest, that are showing that it can have a wide range of benefits, from elevated mood to decreased blood pressure to decreased cortisol checked in labs. And they're trying to pinpoint the exact mechanism for why it works, but they haven't been able to. It could be the colors, also things put off by the plants. But something that was really interesting is that when you go into a forest, you're really like in an aerosol environment. We don't realize it, but these plants are putting off all kinds of, what do they call them? Phytosins is what they're called. And when we take that in, when we breathe that in, it actually has a number of health-promoting factors for us, similar to essential oils in a way. So,
yeah, and there are studies that show that it has an impact upon heart failure. So we were just talking about heart failure as one of the possible causes for, that fluid overload. There are studies showing forest bathing. That's the English term. A lot of these studies have been done in Japan, and something yoku.
Shinrin yoku.
Yeah, Shinrin yoku is the. Yeah, you can help us out with the pronunciation. But anyways, the whole idea is in regards to getting out into forest environments and then spending time in those forest environments and the health benefits associated with it. And that forest bathing has been shown to improve various different heart failure markers for individuals. A lot of the studies are done where one part of the study is conducted in a forest environment, and then the other part of the study is conducted in a city environment. Same activities, same amount of time, same exertion levels, and other types of things like that. And the difference is just the environment in which you are in while you're taking a walk or resting or other things like that, and showing that forest environments are definitely much better than city environments, and it has all sorts of health benefits that they're understanding. One of those health benefits is the increase in natural killer cells. And natural killer cells are part of your innate immune system, and the innate immune system is, you've got two basic components of your immune system. You have your innate components, which are always there and always active, always working, and then you have your adaptive immune system. And the adaptive immune system is the part that learns and adapts to what has been exposed to. Usually what we think of with the immune system, we think of antibodies, and then we think of cells that can identify specific bad guys and kill them. Now, that's part of your adaptive immune system. Your innate immune system is the part that's always active, doesn't have to be exposed to something, doesn't have to mount up a response in order to develop antibodies and specific guys that can go after this one specific problem. But it can go about and take care of a lot of different issues, and the natural killer cells are part of that, and your NK cells increase when you're in a natural environment. And some of these phytocyans have been shown to.
So they actually took cancer cells, and they looked at the activity of natural killer cells when people were exposed to these foreign environments, these natural environments. And what they found was that when you actually take like the bark of some of the trees and you kind of distill off the essential oil, you can actually, you see that it increases the activity of natural killer cells. But what's interesting is when you're actually in the forest environment, not only do you increase the activity, but you increase the number of natural killer cells. And so yeah, a number of health benefits when we get out there, even for cancer. So it's definitely, and yeah, I'm sure there's many more things that we're going to discover as we go through that, but that's just a few of the things that science is actually showing. Natural environments, the health promoting properties of natural environments.
So Ashwin, what are your thoughts about natural environments and COVID?
Well, like we discussed in our talk, the problem is that a lot of people are isolating away from the natural environments, and the natural environments which would be outside of enclosed spaces, are where you get a lot of the benefits that can actually enhance the immune system, like what was being shared. You get lots of sunshine, for example, and with sunshine comes, of course, we get our vitamin D, right? Well, our vitamin D levels increase, and we looked at the associations with vitamin D deficiencies and infections, and so getting lots of sunshine will increase our vitamin D levels, which will increase our resistance to infectious disease, but also getting fresh air, right? And we looked at how fresh air is better for the body than even medicine, right? Fresh air is better than, and our bodies will do better when deprived of food than when deprived of fresh air. So, so those are all important things, and of course, there's lots of oxygen that's being put out by the plants around. There's, getting some exercise in your natural environment will increase your immune function as well. So, just to name a few things.
Mm-hmm. I have heard it said that that there is not flu season or cold season. There is only vitamin D deficiency season.
Mm-hmm.
And the reason why we find so many colds and so many flus during the winter months is because we have lack of access to sunshine,
Right.
and vitamin D levels go down, and individuals therefore are more susceptible to infectious agents in those times with vitamin D deficiency.
Yes.
Or
and-
so I've heard.
Yes, so we actually talked about that a little bit in our discussion as well, and it's even been looked at with different regions of the world as well.
Mm-hmm.
So yeah, it's really, because I mean, what happens when it gets cold outside? When it gets cold, we go inside, and so you're in the closed spaces. You're not really in direct sunlight, and then you're in more close contact with other individuals, and so your vitamin D levels are going down, your immune function's going down. There may be some susceptibilities besides just the vitamin D deficiency. There may be other susceptibilities, and people just tend to get more sick during those times, and it happens every year.
Mm-hmm. Question?
Sunlight also kills bacteria and viruses. When I was a child in my country, TB was around, and what you do, you hang your clothes outside on the line to dry. You put out your sheets and pillowcases and even the whole pillow outside to get sunlight. You switch them over when they get a good bit of sunlight. And there are times that you even put your mattresses outside so they can get some good sunlight. And the reason for that was to kill the TB germs. So that's a good, the sunlight is also good for killing bacteria and that sort of thing.
Yes. There are certain bacteria that do quite well in the sunlight, but viruses typically are very susceptible to damage from sunlight. For example, your coronaviruses, they do not handle sunlight very well at all, and as far as I'm aware, there have not been any major spread of coronavirus in open outdoor environments. The contact or the locations where much has been tracked to. Of course, how can you ever know where when you can't see the agent? But most of it has been tied to indoor environments and so on, not sunlight exposed environments.
I had a personal experience when I had COVID back. I think it was 2020, around June, July, and one of the things that was really that was really uncomfortable about it at the end is just this chronic cough. It's like you can't stop. You just cough and cough and cough. And myself and another person were going through it at the same time, just back over there in the dorm. And he would go out and he'd just lay out in the sun. And he's an older Russian man, so he said, "Eric, you need to get outside." And so I did, and you know what's interesting is within 5 minutes of getting outside, the coughing stops. And it happened multiple times. As soon as I would get back in, within a few minutes, the coughing starts again. So that to me was, it was really like a personal experience of the efficacy of nature. I don't know how that worked. I don't know what it did, but it just calmed the cough reflex completely for like 20 minutes or as long as I was out there. So it does do us good to be out there.
Amen. Do we have any more questions? If we don't, all right. We got another one. It's okay, you can ask it.
Yeah, what do you do for a chronic mucus in the throat? It seemed never to go away for ages. Oh, I mean, what could be the cause? What could be the cure?
Okay. Chronic mucus in the throat.
One of the things is dairy. Dairy can cause issues with mucus. Also, a lot of the processed foods, when you start getting away from it, you start noticing that you get cleared up. Going more towards a whole food, plant-based diet, I'm sure can do wonders for that. Does anyone else have anything else to add?
If somebody has any like sinus issues or allergies, some of the things that can help, let's see, facial contrast, and I guess it depends on what is the cause of you said it was the mucus in the throat, golden seal, echinacea, nettle, facial steam, yeah, that's a good one. Yeah, anybody else?
Neti pot?
Oh, with peppermint, Dr. Sanchez is saying.
No eucalyptus.
Okay,
No
pepper.
eucalyptus. Yeah, no eucalyptus.
Yeah, I mean the mucus doesn't start in the throat. It's usually a post-nasal drip from the head sinuses, and so anything that you can do to, of course, enhance the immune system to fight off any chronic infections, or anything to clear the mucus, the sinuses, like doing the contrast face baths where you put your face in hot water for 3 minutes, and then you put your face in cold water for 30 seconds, and you do that like 5 to 7 times. That really, really helps. Another thing is the neti pot, where you have, it looks like a little porcelain teacup, I guess, with the spout, and you put it up to your nose, and you run some water, it's filled with water, and you put it in one nostril, and it runs through your face sinuses, and it comes out through the other nose, and it comes out bearing gifts of whatever was inside. You can also do the steam inhalation, as Dr. Adan was mentioning, with peppermint. What else? I mean, you can do. You can even do some heating compresses for the throat to help you to loosen up some of whatever's there, and also drinking lots of water to thin the mucous membranes, so you can bring up those things. And especially important, like I want to emphasize what Eric said, is really stopping all dairy products and anything that might be suppressing your immune system in some way.
Yeah, and that includes sugar. So sugar can suppress the immune system function, and so some individuals, they might not be doing dairy, but they're getting quite a bit of sugar in their diet, and that can be something that contributes to that and can help with suppressing the immune response to a chronic sinusitis, and so an individuals can develop or have a chronic sinus infection that lasts for a long time. Mucus production doesn't adequately get taken care of, and then you end up with that drainage. Sometimes pressure is not an issue with a chronic sinusitis. If you have an acute one, usually you feel a lot of pressure and pain and you feel miserable. But with a chronic one, sometimes you don't even feel the pressure. It's been there for so long, and you've gotten accustomed to it. But there's just this long-term infection that's there, and sugar will not help with that. And as was mentioned, dairy is not going to help with that as well. But all of your lifestyle factors, then doing the hydrotherapy treatments to the face, lots of water so that the mucus thins out, and then some natural antimicrobials like Echinacea, golden seal that have been mentioned already, garlic, yeah, and so on. And another question back here.
Thank you. What would you suggest for helping somebody who has eczema? My nephew, he's 3 years old, and his whole entire body is covered. He is constantly scratching. He had numerous allergy testing, and they have identified so many different allergies. He's on a very limited diet, and his mom and dad put some type of white cream on him, but it doesn't seem to help him. So they're at their wits' end, and this little boy, he scratches all day long. His dad just texted me and said, well, ask the question. I mean, they're desperate. They don't know what to do. So what can be done to help him? Then I have another question after that. Is there any type of natural treatment for chronic venous insufficiency?
Okay.
Thank you.
So eczema and then chronic venous insufficiency. Eczema.
Well, you can go ahead. Okay, all right. Well, if he wasn't 3 years old, if he was older, I would say fasting really helps with those kind of situations. But since he's 3 years old, fasting may not be such a
And his parents are watching.
Okay, well, hi. Fasting may not be such a good option for a 3-year-old, but some things that were even emphasized before, anything that may be suppressing immune function, if there's dairy in the diet, if there's sugar, especially refined sugars, not necessarily talking about like the fruit sugars, although someone's really sensitive, I suppose. But usually, cutting out all dairy and animal products entirely, meat and everything, cutting out, sugars, refined sugars especially, and refined products. And then topically, there are a few things you can do. Something that may be soothing for the skin that we've done before with a number of individuals is using oatmeal scrub. So you put some oatmeal in a sock, and then you wet it down under water, and it becomes like this squishy sponge, and you can rub it on the skin of the individual, and then wash it off gently, and then use even aloe vera afterwards. You can also make a salve with maybe like coconut oil as the base, and you can have in there tea tree oil, frankincense, myrrh. You can even use things like calendula, and those work really well for those kind of skin type of things. And you put it, you rub it on at nighttime or whenever it's getting really dry. And some people do well even with like green juices and things like that. But again, for a 3-year-old, it's kind of tough to do those kind of things. I'm not an expert in the 3-year-old department, but charcoal baths is another one. Charcoal, even clay baths is another thing. So.
Yeah, certain allergens as well, like gluten allergy or whatever you're eating can cause these skin issues. Sun also helps. Sunlight also helps.
Yes.
Being outside in the sun helps to clear up the skin issues.
Yes, yes, yes.
Something else that came to mind is also the environment of the child. So, you know, sometimes in eczema, like stress and anxiety can cause a flare-up. And where do children tend to feed off of? It's typically their parents. So for the parents taking that into consideration, what is the home environment like? So, yeah.
Yeah. On that note or on that thought, when I'm dealing with a child or consulting with parents in regards to a child that's sick, my first question is, what's going on with mother? That's my first question. And the reason for that is like eczema. Eczema is an autoimmune condition. So you have the immune system that is attacking skin cells and then causing them to break down. So you have an immune response that is attacking the skin, leading to the development of, or the manifestation of eczema. And so what is it that controls the immune system? Well, the immune system is under control of the nervous system. And the nervous system, right, what is it that controls the nervous system? Well, the nervous system is controlled. Well, you could say that the nervous system includes the mind, and that's fine. Let's call it the mind. It's under control of the mind. And it's not just the brain. The mind is more than just the brain. But it's the mind that controls then the nervous system. And the question is, what are the thoughts? What are the issues that are going on inside? When we read the Bible, the Bible talks about a number of things that affect the bones or the bone marrow. Now, one of the songs that we've been singing all throughout this week is Proverbs 17:22. Right? A merry heart does good like a medicine, but a broken spirit dries the bones. Well, what is it that's in the bones? The bones are not just the physical structure which the muscles are attached to that make a framework for you to be able to stand and walk and move and everything like that, but the bones are also the birthplace for your white blood cells. They're the birthplace for your immune system. And so a broken spirit can dry up the bones, meaning that a broken spirit can have a significant impact upon immune function. And indeed, when you have somebody that's developing autoimmune conditions, it's quite common to be able to, I mean, if you ask, most doctors aren't asking because they just don't have the time, but if you ask, you'll find out that there are major stressors or major losses in the life of the individual before they start developing the autoimmune condition. And with children, their parents are their primary source, and primarily mother. Mother's the major source for the child. And it's kind of the spiritual source that the child is taking from is mother. And so if mother, being the well, is poisoned, so there's things are not going well, she's stressed out, she's her thoughts are not consistent with God's thoughts, because we're created in His image, so we are created to think like God thinks, and when our thinking deviates from His thinking, then there's dysfunction that happens because of that. And the child is really programmed to really take primarily from mother, and then as it grows, it takes more from father, and then it begins to take more from other relationships over time. And so I'm always wondering about mother, what's going on, because she's the well, she's the source that the child is in essence drinking from a spiritual standpoint. And if that spiritual well is polluted or has problems with it, then the child's going to get that, and then the child will manifest it. So again, my first question is, what's going on with mother? Might not just be mother, but that's a place to look at, a source to go to and say, okay, well, what's going on from that standpoint? And then having mother and father working on their own, issues with God, trusting in Him, learning to bring every thought captive to the obedience of Christ, as we're told. And as those thoughts come into line with God, as they become a purer source, then, or if there's conflict or other things like that, resolving the conflict that's there, then that's not something that the child is taking from anymore. And I do know of cases where the parents have resolved certain issues and the child started improving physically through that mechanism. And it's a mechanism that not many people recognize, and so you don't usually ask about it, and so then you're not really discovering that as far as an issue is concerned. So it's something to take into consideration with that, and with any child having significant health challenges. All right, so the second part of the question was chronic venous insufficiency. What can be done for chronic venous insufficiency naturally? And then we've got a question here, and then online, and then over here. And so we'll get to them in order. So venous insufficiency.
Other than wearing support socks.
All right, other than wearing support stockings, we got that one down, still have chronic venous insufficiency.
Okay. I think it's chestnut, horse chestnut.
Horse chestnut.
Cream can actually help a little bit with this, along with the compression stockings. But this has been shown to actually help chronic venous insufficiency. Any other thoughts? And
there is a book called Sunlight by Dr. Keim, and he's done studies, or there's studies published in his book that says sunlight can help with chronic venous insufficiency. So it might be worth putting your feet out in the sunlight, or legs. Sunlight? I can give you a copy.
All right, so sunlight exposure to the legs and horse chestnut cream are a couple of things that have been shown to be beneficial. Usually you have to look at, how do you figure out reversing the vascular or the venous insufficiency, and that's not an easy thing to do. Usually it ends up being chronically trying to manage the pressure differences between the pressure inside the blood vessels versus the pressure outside the vessels, and trying to keep edema and swelling down to a minimum. And of course that includes the compression stockings and keeping the legs elevated when you can, not wearing tight bands around the abdomen, and so making sure it'd be much better to wear dresses, not have anything tight around here, because then that increases the pressure in the blood vessels, because it starts pinching off some of the blood flow, return back to the heart. Making sure that the legs are as warm as the rest of the body, so as well clothed as the rest of the body. Those are all things that can be helpful or beneficial, but really reversing the problem.
Just one more thing to add to the mechanism or the physiology that Dr. Mark just mentioned. Understanding that in the veins, when you have the blood returning to the heart, it's the valves. You actually have valves in there that help with that blood return, so that the blood is not flowing backwards. And whenever those the valves are affected and they're collapsed, they're not working the way they're supposed to, then you start having the pressure problem, because you have this backup, and that contributes to it. So to begin with, to even prevent that, getting those valves working the way they are, or helping it, is making sure you're walking, going for your exercise, and keeping those veins working the way they're supposed to.
You know what I noticed? I noticed, like, you did mention the horse chestnut, and I did try that. And, you know, it did help me feel a lot better. And I used to be like a meat eater. And, you know, and I used to eat a really not unhealthy diet. And then when I saw, like, sometimes when I would fast and I would just eat a healthier diet, I wouldn't have to use my stocking at all. So my diet and that horse chestnut helped as well.
So those are things that are beneficial, but I don't know that we have anything yet that proves a reversal of valvular injury or valvular damage, because the valves are usually made up of connective tissue, and the repair of connective tissue is really difficult. That's why, you know, if you have heart valvular issues, usually the solution for that is going to be a valve replacement. And there aren't any any vein valve replacements that I know of. That would be an interesting intervention, but
When I went to see a doctor, though, they wanted to ablate my GSD, and I said no. I don't know. I'll just use the stockings. I'll trust God. I use some horse chestnut, and sometimes I put like cold compresses because it hurts sometimes. But since I've been here, I haven't had to use my stockings at all because you guys feed me good. Because I just said, well, if you take my GSD, what if I need it for a bypass surgery? You know, they wanted to ablate it. So what is your thoughts on that?
okay, so the comment and the question has to do with the recommendation that you receive from the vascular surgeon is to remove one of the veins in the leg that is probably the most problematic with the valvular insufficiency. And the idea behind that is that if you have a particular vein that has bad valves and it's dilating and creating problems, then if you remove that, then you don't have the bad valves in that section. The return blood flow back to the heart can go through different veins that are there. If it was the only one, then that would be really bad. But there are other ones that can take the load. But if you have the same clause that's in place, then the same valvular dysfunction is going to happen in the different valves, in the different veins that you'll have. And so it's basically a way of kind of buying time. But if the same cause is in place, you're going to end up with the same result anyways, right, down the road. And that's one of the problematic things about it is it does buy you time, it'll buy you some years, but then you end up with the same problem again with fewer veins, and now the problem can progress faster. Question here?
Well, it's actually a testimony I wanted to share in response to the eczema condition. I'm not sure if it would be helpful for a child, you know, that young of age, but I had a friend, or have a friend, she, her eczema, I think, derived from taking steroids for another condition. And I'm not sure how she came up with the connection with doing a liver and gallbladder cleanse, but she did that for over a year. And within the first 2 cleanses, because she did that once a month for that year period, she started to see improvement. And after like a year of doing that, her skin has pretty much cleared up. And you just mentioned that this child has allergies, so I'm not sure if there's some kind of like block in, you know, the child's like detoxification system, but that's just what came to mind.
Yes, and good detox for for the liver includes a healthy lifestyle and lots of water. And there's some herbs, although with a 3-year-old you got to watch out about what kind of herbs that they have. But getting a lot of wind flow there. Okay, like here, and here. But there are some herbs like dandelion and milk thistle that are good for the liver and its function. Hot and cold fomentations over the liver And fasting can be beneficial, but again, not for a 3-year-old. I'm going to come back here, and then we'll get to you.
Okay, the person who asked about the adhesions said, thank you. And the question is there any natural treatment for glaucoma?
Natural treatments for glaucoma.
Well, there's some interesting studies about ginkgo biloba being beneficial for preventing and possibly improving situations with glaucoma. It also depends on what type of glaucoma, angle closure, the other one, and open angle closure. So for some people, they do surgery for that, although what we really want to do is just decrease the pressure, the ocular pressure, and and reducing other risk factors. Anyone else want to comment in?
Coleus forscolis. Yeah, there is a herb that it can help for this problem that Ashwin was mentioned, that increasing that the pressure in the eye, and it's called Coleus forscolis. You can get it in a pill or capsule remedy, or probably as like the herb. Coleus forscolis.
Coleus
Coleus forscoli.
Yeah.
Coleus forscoli. Yeah.
COLEUSFORSKOLI, I think.
I think it might. Is it I or two eyes? Two eyes, I think.
Yeah.
And they're two separate words.
Yeah.
And also increasing your fruit intake and vegetable intake, also.
All right, we've got a question. Oh, and the lemon juice in the eye, like for I've heard some anecdotal reports that helped individuals with their glaucoma as well.
Also, treating the underlying cause of the glaucoma, diabetes, hypertension, high cholesterol. These things are, maybe the cause of the glaucoma. Sometimes you don't have to necessarily have high blood pressure or diabetes or high cholesterol to have glaucoma, but it's been shown that basically is a pressure issue with the eye. So you may not have hypertension, but you have hypertension in the eye vessel. So lowering your sodium intake, eating a good fruit and vegetable diet, drinking water, that may lower your pressure in your eyes.
And don't wear neckties.
Yes, don't wear neckties.
Neckties increased intraocular pressure. All right. Yeah, one reason not to wear.
What could you do naturally if for hypothyroidism?
Hypo.
Hypo.
All right, hypothyroidism.
And hyper.
All right, so let's get hyper and hypo. And, all right, so thyroid disease.
Just go for it. Okay, fine. Thyroid disease. If you're talking about hypothyroidism, first you want to find out what the cause is. If you're having autoimmune causes, then it's like your Hashimoto's, hypothyroidism, which most likely you started with, well, we'll come back to that. Just thinking of mechanism, but if it's the Hashimoto's, then you have the underlying autoimmune component there that you have to also address, but just focusing on the thyroid itself. Your thyroid, of course, functions on iodine, and so getting a good source of iodine. Table salt is not my number one go-to for iodine sources. Your kelp, some type of seaweed, Kelp is a good one that's very high in iodine. And some people will just go for the Lugol's iodine. So you want to have a good source of iodine. And then you also want to look at your diet. For the hypothyroidism, this is when the thyroid is not functioning well. You want to get the iodine to the thyroid and make sure it is bioavailable, which means the thyroid can use it. If you're taking in a lot of cruciferous vegetables, it actually tends to block iodine uptake by the thyroid. So you want to reduce it, not that you don't eat your cruciferous vegetables at all, but you want to reduce that. What are your cruciferous vegetables? Broccoli, cauliflower, kale, cabbage, bok choy. So you want to reduce those. That will help with the iodine uptake. You want to have the iodine on board so that it's available for the thyroid to use. And then there's some herbs also that can help. Gogol, actually, it's not an herb, it's a resin from a tree. But you can use that to actually help with the
Google,
G-U-G-G-U-L.
Right.
What is it again? G-U-G-G-U-L.
It's like Google for Google.
So you can use that to actually help with hypothyroidism. Switching to hyperthyroidism. So the thyroid is overacting. You want to cut back on its action. This is when you go crazy with your cruciferous vegetables. You want to block that iodine uptake, some of it, not all of it. So taking your cruciferous vegetables, just having a nice feast on that daily will help. Of course, monitoring the thyroid function also. Something that I forgot to mention for hypothyroidism. In the morning, first thing in the morning, instead of taking a warm shower, take a cold shower. It wakes the body up, and your thyroid actually helps with your homeostasis in the body. So you want the thyroid functioning, you get a cold shower, it starts the thyroid going in the morning.
I mean, taking consideration what you said about taking the cold showers in the morning, well, I mean, the reason it's just to increase your metabolism because you have a hypothyroidism. I mean, your metabolism is going to be okay, but it's going to be kind of like the low side, right? So any kind of treatment that's going to increase your metabolism, hot and cold or cold in the morning, exercise in the morning, sunbathing, and any kind of treatment that is going to increase your body temperature. Mm-hmm.
And whether it's hyper or hypothyroidism, then hot and cold fomentations to the thyroid are beneficial.
Heating compress.
And yes, and a compress or a poultice over the thyroid. We have used comfrey in the past. We have used castor oil. We have used almonds, so ground almonds or like almond butter as well. With that. And then, of course, regularity is something that's very important with any condition. But, one of the prominent causes for hypo is your Hashimoto's, and for hyper is Graves. And both of those are autoimmune conditions. And with autoimmunity, regularity is highly important. And again, there's questions of getting the thoughts and everything under control as well.
Okay, I have two questions. Okay, what would you suggest? I have like hypersensitive lungs. If I drink something and it goes down the wrong way, my lungs start spazzing and it just gets out of control and I have an asthma attack. If I'm eating something and it gets down, and I'm talking maybe and it goes down the wrong way, I have an asthma attack. So I want to know, is there anything natural I can do to strengthen my lungs? Any antispasmodics that I can take that will get my lungs strong? And my second question is, my mom had dementia, and is that inherited, or is there something that we can do, whose parents had it, to minimize our risk of getting it?
All right, spasm, lungs, we'll throw that to Ashwin. And
Well,
she'll watch.
Okay. Well, with the first part of our question, the asthma and strengthening lungs. First of all, if things are going down the wrong pipe, we need to slow down. Slow down. If things are going down into the lungs instead of into the stomach, then we need to slow down and drink slower or eat slower, chew better, not talk while we're eating or doing those things so that it minimizes those incidences. That being said, ways to strengthen the lungs and improve pulmonary function. There's something I've actually been doing an experiment with resisted lung exercises. And it's where you actually pinch off the nose and you breathe through something that actually reduces the diameter of how much, the diameter of your mouth, essentially, how much air can get in through your mouth. And you do these exercises by inhaling, and you basically, when you inhale, you kind of let your abdomen kind of stick out, and what it does is it actually forces your accessory muscles to develop and strengthen so that it makes breathing a little easier. There was a device that was developed fairly recently, and it was designed for fighters. Fighters who, get into the ring and fight. And they were using this thing which basically does that. It just restricts the amount of air that can flow in at one time. And as they started training with those things in, they found that those who had asthma their asthma was improving or completely disappearing. So that's one thing that can help is training the inspiratory muscles, which is resistance training of the lungs. Other things that can be done for asthma, of course, eliminating all animal products, doing some exercise, not overeating. Overeating can actually trigger an asthma attack, cutting out all oily foods, fried foods, and then taking in certain herbal teas like echinacea, golden seal, of course, then mullein, lobelia, licorice. These are all things that can really help with that, and drinking lots of fluids to make sure you're able to cough out secretions before it becomes a problem, and overall reducing inflammation, doing chest fomentations, doing onion poultices. Just throwing out a bunch of things out there. Vitamin D actually decreases the incidence of lower respiratory infections, which can also, not just for infections, but even for reactive airway dysfunction. They've seen people who take high-dose vitamin D have less, their lungs are not as reactive, not as inflamed, and they can, it improves their overall pulmonary function. So those are. Oh, good question.
Repeat it.
The question was, what is considered a high dose when it comes to vitamin D, right? I've seen some studies where they were doing, 10 to 20,000, and I've seen others where they did like 40 to 50,000 international units. Yeah, and also vitamin D, your intake, the dose you take is dependent on your body type as well.
Yeah, there was one report that I recall of an individual that was having significant lung issues and tried everything, wasn't getting taken care of, and they were started on some high-dose vitamin D. And they were pushing their blood levels, I think it was above 100. as far as their serum blood levels for vitamin D, and it was after they got into that range that their lung function really started to turn around, and they started to be able to breathe quite well without all of the defects and deficiencies. So it's quite interesting because they were in the kind of the quotes toxic range for vitamin D3, but then that appeared for them to be the helpful range as far as pulmonary function was concerned. So that was a curious.
Yeah, and just to comment on that, like there were some articles that were showing that people can even be in that range of the 100s or so, but they won't have symptoms of toxicity until they're above a certain point, like 130 to 150 or something like that. Don't quote me on that, but it's just an interesting thing that some recent articles have been pointing out.
All right, we've got 2-3 minutes. We had the next question about dementia. Does it run in the families? And then we've got one online.
Just very quick comment about vitamin D. It's better to take daily than take monthly mega doses, okay? Daily, yeah.
All right, dementia.
Quick one with dementia. Yes, it can run in the family. You do have a gene, the ApoE gene, that's associated with dementia. And the ApoE4 is the one that's really, really significant for this. But remember, we went through like dementia and what you can do for dementia. Your nutrition, exercise, getting enough water, sunshine, air, rest. But the main thing to remember is that your genes can actually load the gun. Your lifestyle pulls the trigger. So if you're maintaining a good lifestyle, the gene should not be activated.
All right, online question here.
All right. So question is, would low BP, I'm going to assume that's blood pressure, would low blood pressure readings be flags for heart failure? If so, what readings would be alarming?
Well, you look for certain signs, and blood pressure is one of those signs that you look at, and low blood pressure could be a number of things without context, right? If you're looking at heart failure, there are certain signs that we can notice with heart failure. For example, people who have left-sided heart failure may develop, fluid buildup in their lungs. People with right-sided heart failure, you may see swelling in their legs, especially their right leg, or they might see like some jugular vein distension and things like that. Or if they're really having a bad time, you'll kind of hear both, where their lungs have fluid and they're all edematous and they're breathing really fast, and that's usually not a good thing. So that would be, with that, but that's more of like towards an end stage situation, but people can have the beginnings of heart failure, and normally we would think of things like edema to be one of the signs we look for. With low blood pressure, I mean, what are the reasons? It could be hyponatremia. It could be if you're not absorbing sodium well. It could be malnutrition. It could be normal if you're under a certain weight, and that just might be your low blood pressure. It could be
infection, sepsis.
Infection, sepsis, if it's something like that. So
right. As far as heart failure is concerned, heart failure is usually associated with high blood pressure, not low blood pressure.
Right. Yeah.
And so you are most often going to see heart failure along with hypertension. And as the heart failure gets worse, the hypertension is going to persist until you get to the point where the heart is really at the very final stages of failing. And when that's the case, you are in the hospital.
Right.
by the time your blood pressure goes low at that point. So if you have low blood pressure and you don't have really serious manifestations, then it could be normal. When my wife and I were, when we were living in the jungles of Nicaragua, we got a bit scared when we were doing deliveries, because then we'd measure the blood pressure on the ladies and they had blood pressure like 80/40. Having a baby, and I'm thinking, oh no, we got to start an IV and we got to give them fluids, and they're hypotensive and she's probably bleeding out, and and all of this kind of stuff. And so we were all, but after we were there for a while, we realized, oh, hey, her blood pressure is like 80/40, and hers is like 80/40, and hers is 80/40. And they carry 80-pound packs of bananas on their head through, 2 hours through the jungle, and have a bunch of babies and all that kind of stuff, and their blood pressure is 80/40. So what's a low blood pressure? Well, low blood pressure is one that's below 100/60 or so, and you have symptoms. Right. So if you've got symptoms of low blood pressure, so you're getting, lightheaded when you stand up, you pass out, weakness, fatigue, other things of that nature, then that's where there would be some concern. But if your blood pressure is low and you don't have any of those symptoms, then it's really not a problem, typically. But it would be good to get checked out and just to make sure that all the rest of the symptoms are working. It's been a pleasure to be with you. Our time is up. I know we had a few more questions that we couldn't get to. Sorry about that. But let's go ahead and pray and wrap up now and thank the Lord for the time He gave us. Let's see. Eric, would you pray for us?
Sure. Heavenly Father, we want to thank you so much for this time that we've had together, and we want to thank you so much that you are the source of our healing. And we want to thank you also that you've given us many different things in nature to help us. And we just pray that you would bless the information that has gone forth, Lord, that the people who had inquiries, they will find these things helpful. We pray that you'd give them strength and wisdom and efficiency to apply these remedies. For any questions that were not answered or were not answered sufficiently, we pray that you lead them to the extra information that they need to know. And we pray that that you will be with us the rest of this day. And we thank you. We ask these things in Jesus' name. Amen.
And before we cut the broadcast, if anybody is interested in more information, you can go to uchipines.org. That's UCHEE, Pines, PINES.org. And there are several resources there that are available for you. One of those is counseling sheets. So we have over 500 different counseling sheets on various different conditions and things that you can do for those, like the question in regards to thyroid disease. You can look up thyroid disease or thyroid on there. It's a searchable database that you can look up, or it's in alphabetical order that you can go through and look at that up. Also, we have a YouTube channel, and if anybody's online right now watching, you know that we've got the YouTube channel, and there's hundreds of videos that are on there that you can access as well. And then we also have phone consultations that we do from anywhere and everywhere for any individuals that have additional questions that weren't asked or answered now. So those are available also. Thank you very much. God bless.